Hi, I'm Steve Adubato, right here at Saint Barnabas Medical Center. I am pleased and honored to introduce Dr. Mike Reber, who is the co-director of the Joint Institute here at Saint Barnabas Medical Center. Good to see you, Doctor.
Good to see you.
Talk to us about the Joint Institute. What exactly is it, and what makes it stand out in the marketplace?
Well, the Joint Institute, we started that a few years ago because it just offers better care to the patients. We have better ratios from nurses to patients. It's focused on what we're doing. So it's the orthopedic floor. It's focused on our total joint replacements. We get them out of bed the same day. We have preoperative planning and discussions with the patients, so it's not something new to them. So they show up the weeks before. They get a lay of the land. They understand the floor. They see what's going on. They're comfortable. And that's most of the recovery, is being comfortable, not being afraid of what's about to happen. And once you feel better about it, it's a much easier process. We have to understand it's about 500,000 hips done a year across the country. That's only going up. We're more active. We're living longer. So more and more people are going to need joint replacements. So when you come into the orthopedic office and you have pain, you can't walk long distances, can't go up and down stairs, you can't get up out of a chair, and you start failing conservative treatments, which other options may be physical therapy and medication, maybe the use of an assisted device like a cane or a walker. Right. And when you fail that, and finally the x-rays and your physical exam and everything point to that arthritic joint, now you're ready. You're going to want it. What I love about orthopedics is nothing you have to have. It's not cancer. It's not a cardiac event. This is quality of life. So when you come to the orthopedic surgeon or me and say, I don't want to go on like this anymore, I am hurting, then the answer is there, and it's very easy.
And so let's talk about the hip part. You showed me before we came in here. Let's pick this up. This is fascinating. Even as a layperson, I picked this up. This is a typical hip, if you will, and it's got obviously everything that goes around the hip. Talk about what was, or what is the traditional hip replacement surgery, and then the new anterior, if you will. Give me the technical name.
Direct anterior.
Direct anterior hip replacement surgery, and the difference.
Okay, so a direct anterior hip approach, what's nice about it is, first of all, it's been around for decades. It's not necessarily new, but what we've done is just made it a little better. We have better instruments. You know, the companies have understood that this is a great approach, and we want to make it better. So here is the front of your hip. So you're laying flat with your face up, and here is your hip. Tensor fascia lata muscle right here, and you just, when you make your incision right here, you just move the muscle out of the way.
Right.
Then you move these muscles out of the way, and right now you're at your hip joint. So it's very easy. I didn't cut anything.
Right.
I didn't cut any tendons. I just moved the muscles. I have special retractors to hold the muscles out of the way. And here's the hip capsule, and behind it is the joint. And now we have great instruments to help do a hip replacement right from there.
That's the traditional method.
No, this is the new. That's the new. This is what's so nice about this. Or the traditional old method is going through.
Back up.
Sorry.
This way, you can do this without a lot of
any dissection, without cutting, without removing tendinous attachments. You're just moving muscles out of the way, and you have great exposure.
Well, you know what? It's interesting. You were talking about moving. I always thought you were talking about cutting. You're literally talking about moving.
We have retractors. We hold a retractor here and a retractor here, and I have exposure of the hip. And
no cutting.
I didn't cut anything.
Now show me the more traditional.
So the traditional method. So we go through the muscles here, and once you get through the gluteus maximus,
go through meaning
just split the fibers, and you're cutting through the muscle. Here, now we still have these muscles. These are the external rotators of the hip. We have to remove their attachment on the femur, lift them up, and then we have exposure to the hip. So you're weaker. It takes a little bit more time for recovery. There's a higher risk of dislocation. And now, with this method, we haven't cut anything. We don't give you any hip precautions. You just get up and go. All those precautions, you can't bend your hip more than 90 degrees, and you have to watch out sitting on low seats. I don't give patients any restrictions. I just say go. And I've had people leave the hospital within a day or two. It's being done almost as an outpatient procedure with a direct anterior approach. Less pain, potentially less bleeding. I don't want to make recovery is they come in to see me to have their wound checked within 2 weeks. They're walking without a cane or a walker.